I had to twist Mell Ann's arm, but I just told her she had to do one more interview for me because we were talking before we started this. And one of the things that was so interesting to me was talking about heart attacks in women. And as most of you know, that this is the #1 disease or killer disease, I guess you would say, among women is heart. Now, February is actually Heart Month, and this month is Breast Cancer Month. But Mell Ann had an interesting story I felt like that needed to be told. And two, I think it's real interesting that the signs of a heart attack are somewhat different from a woman than they are for a man. Now, this is not to leave the man out. We'll get to them too. But I did want Mell Ann to tell you a little bit about the signs for a heart attack in a woman.
Women generally have different signs and symptoms of something going on with their heart. And I'm just generally speaking. It's not limited to these. It's not only these. Where men will usually clutch their chest and have a heavy crushing type pain and break out in a sweat and get, it's an event with them usually. Women may have more subtle signs and symptoms. They will maybe get a little short of breath and they'll think, oh, I'm just tired, or they'll have a little nausea maybe, some hurt in their back or up in their necks, down in their arms, which men can hurt in their arms, their necks, and their back too. But women will have more of this, they just don't run up and say, oh, like a man will. It just seems to present differently. They may break out in a little sweat. We call that diaphoresis. They get a little sweaty and clammy. They get weak, lightheaded, dizzy. But they're just a little different than men.
I always, if I have any type of symptoms, I always hesitate to go because, I don't want to bother them in the emergency room. It's because I feel like they're always so busy and I'll think, well, maybe this is not anything.
It might not be, Miss Sue, but you won't know if it goes too far.
That's true. That's true.
So
time is an essence.
Like I say, yes, time saves heart. There's so much we can do nowadays if we can get to you quick enough. And time saves lives. And that's with strokes, heart attacks, everything. And you need to remember that. But anything that persists like that, if you notice that you're just getting progressively more winded as you walk across the room or go to the washing machine, or you need to take note of that and you need to go get it checked out.
I think so often women will say, I'm under so much stress. That's where I'll go, because stress will about kill me, and I'll think, this is killing me, the stress is killing me. And sometimes it can. It can.
And stress is very, very potent killer.
Well, I do believe that it is, very much so. And I hope that you'll be more aware of symptoms as a woman, that you'll notice them, and also with men, because Mell Ann pointed out an importance, that factors, that it's not just clutching the heart, that there's so many areas. I never knew for a long time that it could be here or in the back, or I just saw, because all our lives we saw this. On TV, that's what you always saw. That's right. Fred Sanford having his heart attack, over and over. And that's always the way I think of it, that it's going to be like that. And I think it's so important that we as women and as men be aware of our bodies. And I think more and more, I'm becoming more and more convinced of this, that you've got to pretty much doctor yourself to an extent. Now, not play doctor, and that's my favorite thing to do, is just doctor. I know it all, doctor, and we don't need a doctor. But that you do listen. And I hope will be aware of McGee's Healthy Heart Clinic, that you will take time to meet Mell Ann, go by, even if you've got a good heart, and take time to meet her and become familiar with it. And again, stress this to anyone that has had any heart problems, that they get connected with the clinic, with this part of the clinic. McGee General Hospital has stepped out. Now you've got to step out and be there with them. They can't help you if they don't know you're there with the problem, and so you need to come see them. Thanks, Mell Ann, and I won't make you talk anymore. And have a great day.